Yeah, so I'm Fiona Walker. I'm doing my PhD at Sussex, supervised by Richard de Visser. And I'm interested generally in my PhD in how alcohol health information in different formats or as part of interventions can play a role in reducing alcohol-related harm. So this study is is kind of an adapted study. I was looking at something using alcohol health unit marked cups, which involved quite a lot of personal contact. And as a result of COVID, obviously I had to change some of my plans and actually found an opportunity to look at how people might process health information during a global pandemic, which has actually worked out quite well in the end. So I'm going to give you a brief overview really of the background to my study and then what it is that I actually did and my results and what I have found. So alcohol health harm, as we know, continues to be a pressing issue, as we've just seen globally across the world. I'm talking specifically about the UK context. We have a really overstretched NHS at the moment. A lot of people might ask, we don't need to be worrying about alcohol at the moment, but actually, with an overstretched NHS, but alcohol contributes to some of the health conditions that can make COVID more problematic, such as high blood pressure, dementia, then continues to be something important. How can we reduce that pressure on the NHS and continue to tackle alcohol-related harm? We know that in the first 9 months of 2020, alcohol-related deaths were at an all-time high. That was a 16.4 increase on the same period on the previous year. So that is not. There needs to be more understanding of exactly what's caused that, whether that's people not being able to access services, whether people have been drinking much more than they were. So there's still a bit of unpicking of that data, but that's certainly quite an alarming set of data. We know that alcohol sales grew prior to lockdown, immediately prior to lockdown, which was perceived to be people stocking up for lockdown. And you see the picture there of empty shelves, just one bottle of wine left on the shelf. And sort of early research into drinking alcohol during the pandemic has been shown that there has been some higher consumption of alcohol and indeed some higher risk drinking, so drinking more or drinking every day, drinking at different times of day. The data is quite interesting because it's a little bit polarized. So some people have been drinking less as well. So again, that's something that we're continuing to understand. So the thing for me that I find really interesting about information is just the complete lack of information that's available for people on the alcoholic drinks that they're drinking. So I think Martin Moreno and colleagues did a study looking at the information that was available in 2013 and said, you know more about a bowl of cereal, what's in a bowl of cereal, than you do about what's in your alcoholic drink. So I've got a little picture here just to illustrate, we've got the, I think there's back of a Cheerios packet, all of the ingredients listed, all of the nutritional information, vitamin breakdown, and on the back of this bottle of gin, literally just this tiny small section here that tells you to drink responsibly. And there is some unit information there. So one measure of 25 mils is 1 unit. So the UK government has very much not mandated by law that any particular information needs to go onto alcohol labelling. So it's very much up to industry to self-regulate. So apart from, I think, alcohol by volume, there's nothing else that they have to put on there. But there have been agreements, public health responsibility deals that have been done with industry to say that they will put all up-to-date 2016 Chief Medical Officer's guidelines on alcohol labels. However, research last year found that more than 70% of labels that were reviewed didn't include those guidelines, those low risk guidelines. So there's a lot of work to do in terms of just alcohol labeling. And that's just one part of information that people have. about what they're drinking. So clearly, information is really important. It can be seen as, a real foundation for tackling alcohol-related harm. Without the information there in the background, it's difficult to develop interventions. And there's a real, sorry to give you a picture of Boris Johnson here, our Prime Minister. I'm sure everybody's seen enough of him recently, but it's this quote, "Take personal responsibility," I find quite interesting. So this, I think, was from at Christmas, when he was saying people should take personal responsibility for what they do over Christmas with regards to COVID. And he's obviously said that this week again, that we're going to move away from a government diktat to taking personal responsibility for our health behaviour and our public health in relation to COVID-19. But I think it kind of fits quite well with the sort of overall public health messages around alcohol as well, that the onus is on the individual to control what they drink and to behave responsibly. And even that little phrase that I showed you before there, saying drink responsibly, it's all about individual and personal responsibility rather than legislation around alcohol. So we know minimum unit pricing evidence in other countries shows that that does work, but the English government very reluctant to implement that. And so at the moment, we really rely on people being very well informed. You can't take personal responsibility for your drinking if you're not well informed. And overall, enabling sort of informed choice has a lot of support. So studies where they've asked people, would you like more information? Do you want to know if alcohol causes cancer? People generally say yes, they do. Only around 16% of people know what the actual unit guidelines are. They don't generally know that it's 14 units a week for men and for women. And yeah, only 13% of people are able to identify cancer as a health consequence of alcohol. So we know that if you do provide information in a kind of a concentrated way, that it does have a positive effect on both knowledge and awareness, and it can also affect people's attitudes and their intentions towards drinking alcohol. So these kind of cognitive precursors of drinking that people are thinking about it, when you target them with particular information in particular ways, they do tend to say they would think about drinking less. So obviously we know intentions don't always translate into behaviour change, but we are still interested in figuring out what is the best way to inform people as best as possible so they're aware of the risks. So sort of the background to my study, some of the things that I'm particularly interested in is this idea of novelty of information and also media focus, so when things are really in the media, and personal relevance. So three aspects that research has shown to be linked to people's likelihood of paying attention to particular health information. So providing novel information has been found to be associated with potential changes. So back in 2016, when the unit guidelines were changed, and at that point they were reduced for men, because it was 21 for men and 14 for women, and they were aligned for both men and women. And at the same time, certain health conditions were added to the list of things that were at risk if you drink beyond those guidelines, and cancer was put in there for the first time because of evidence showing the link between alcohol consumption and cancer. And at that time, people started to Google much more. The trends show that people were looking that up. They were interested in that. It was new information. So that's something I thought, well, maybe there's an opportunity here to think about new information during a pandemic. And also, when something is widely in the media, people tend to pay more attention to it as well. So that might seem a little bit, it's not new if it's widely in the media, but I think it just provides a context. So for example, an earlier study that I did, I looked at messages about mental health and alcohol, and they were very well received. People said, it was a qualitative study, people said, well, mental health is everywhere at the moment. We're seeing it everywhere. So when we see a message about alcohol consumption being linked to mental health, that really resonates, because we know about mental health, we're interested in mental health, and we didn't know that alcohol was linked to mental health. So there's this combination of novel information linked to an overall context of a prevalence of a health issue within the media. And then the other issue is this sort of personal relevance. People sort of can dismiss information saying, well, it's not relevant to me. I'm not interested in that. That's nothing to do with me. But when they find it personally relevant, it does make messages more appealing and is more likely to change their intentions. So within my study, I thought, well, these conditions, the pandemic creates some of these conditions in that there's potential for novel information. So looking, for example, at immune response, excess alcohol can affect the body's immune response with particular risk on respiratory illness. So I felt a lot of people wouldn't know that. There's obviously, we've got this social context in the media of high public awareness of the virus. And therefore, there might be this kind of opportunity for personal relevance. So I wanted to really think about how could a specific alcohol message about immunity, alcohol and immunity versus sort of more well-known health information affect people's intentions and motivations and attitudes towards alcohol. So I wanted to, and at the same time, I thought, well, there's a lot out there about how people are drinking more. Some people are stopping drinking. I would explore that and see what the data was at the same time. So I hypothesized that a sort of relevant message that reflected the social context about alcohol and immunity would be a more persuasive message. I had 958 people in my sample, all aged 18 and older, obviously, and they all completed the questionnaire between April and June 2020. So during the the easing sort of started in May, but most of them, when I looked at when they filled it in, it was sort of April and the very beginning of May that the majority of people were completing the questionnaire. The way that it was set up, I was measuring what their levels of concern were about the impact of alcohol, what their levels of motivation were, sort of on a scale of 1 to 10, to adhere to the guidelines, and what their strength of their intention to adhere to the Chief Medical Officer's low-risk drinking guidelines. And I measured them before and after exposure to a message. So they were seeing that message on screen as part of an image, and they were randomized to one of 4 messages. So these were the messages. Now I've had a lot of feedback subsequently on, that looks like a really appealing glass of white wine. So, you know, rightly or wrongly, I had that image on there, but the message up on the top left was the one that was designed to tap into this idea of immunity. So this kind of call to action, protect your respiratory system, and then drinking less alcohol enables your immune system to function more effectively. And underneath the kind of basic unit guideline message, which was the same on all of them. The other message on mental health, another one on sort of future health and typical health conditions. And then the control message was looking at just keeping that unit information there and a very general protect your health. So these were all designed to be kind of positive about drinking less alcohol to reduce risk rather than, you know, trying like sort of health warnings. So looking at my results in terms of consumption, weekly consumption here, we kind of, more than half the participants were drinking within low risk guidelines. So 11% there drinking nothing at all. And then we've got sort of, you know, a lot of people there drinking within the 0 to 14 units. However, you know, 45% of these people were drinking more. And this kind of worrying red band here, where we've got, you know, 20% of people who are drinking more than 30 units a week. So really heavy drinking in that section. And almost half of the participants said they were drinking more than usual. So even those drinking within sort of 1 to 14 units a week were still drinking sort of more than they normally would. And that was obviously quite a common picture. I asked them as well about their awareness of the unit guidelines. Only 18% of them knew that they shouldn't be drinking more than 14 units a week. And that's fairly consistent with other research that shows the level of awareness. I asked what were the reasons that people were drinking. 65%, these were the 4 most popular reasons: for pleasure, to relax, to de-stress, and then a sort of smaller proportion there saying drinking to cope. I asked that people had an opportunity to actually comment and put something in there, which I thought was quite interesting, brought out a couple of themes. You know, the fact that the habits, the daily habits are different. You know, I'm not doing my normal thing. I'll be able to go back to lower pre-COVID drinking levels when I can resume my usual daily activities. And other points there about how, you know, it's a social thing, it's a way to connect with people. And then showing the other side of that, that people, if you're a social drinker and you're stuck at home, you're not going to drink so much. So for some people, that was the reality as well. So it's quite interesting, this point saying I'll be able to go back to lower pre-COVID drinking levels when I resume my usual daily activities. I've spoken to quite a lot of medical professionals, or GPs in particular, who say that people are not able to do that easily. So this kind of new pattern of increased drinking is actually quite hard to reverse. And we're not back to normal still, you know, we're still in a pandemic. So regardless of it being locked down, I think the uncertainty can still be quite hard for people. So the message intervention, looking at whether my hypothesis was true, that people would be more affected by a message about immunity. There was a significant effect of the message group on motivation only. So I didn't see that effect on intention or on concern about alcohol. So there was no particular difference between the immunity group and the control group for levels of concern about the impact of alcohol on health or intention to adhere to the guidelines. But there was a sort of significant though small effect of message group on motivation to consume alcohol. So those immunity group participants had a stronger motivation to adhere to the low risk guidelines. And that was, I was looking at a pre-post analysis there with pre-post and COVA. So controlling for pre-intervention motivation. When I separated out levels of concern, I had a sort of group measure of levels of concern that was looking at concern for the impact of alcohol on weight, stress, sleep, lots of different aspects. And amongst that was immune functioning. So when I separated that out on its own, the immunity group as well, their concern was significantly higher than the control group. And I had some comments, some feedback that people gave voluntarily on the immunity message. They're saying, you know, I am aware of this already actually, and I've stopped drinking. However, and more messages probably saying, I don't know if this is true. Is this really true? I haven't seen that out there. I didn't know that heavy drinking affected your immune system, and you know, we should know this. We should know this. And it comes back to that idea of, well, of informed choice. You know, people need information. They need more information about what they're drinking. Yeah, I don't understand why I had that effect found that effect for motivation and not for intention. So I'd be really interested in understanding how do people, you know, what maybe those measures, or maybe it was the way it was worded in the questionnaire, or perhaps people don't really recognize a big difference between motivation and intention. So it'd be interesting to sort of tease that apart and understand what's happening there. Obviously, the exposure to the message was very brief. It would be as brief as they click through the questionnaire, because they were controlling how fast they would go through that. So I did ask them to read it. I did warn them. I had a manipulation check in there that I was going to ask them to write down whether or not they knew anything about what they had just seen. And actually, the majority, like around 75%, passed that manipulation check, you know, showed that they had read the message, but it was a brief message. But I think it's interesting to find an effect on such a brief message on motivation as well. So, you know, I think this shows that a novel message with novel information within a kind of wider context that makes sense to people could be a useful strategy for health campaigns and for improving alcohol labelling as well, to try and encourage people to drink within recommended guidelines, and as a basis for developing further interventions to reduce alcohol-related harm.